Good morning and welcome to our press briefing on coronavirus in the country. As you may be aware, the government has been carrying out a robust vaccination campaign against the COVID-19 disease countrywide after the pandemic struck our country. This exercise has been a great success due to the cooperation we've received from county governments, as well as the many Kenyans who heeded to our clarion call and turned out in large numbers at the various vaccination centers for their first, second, and even their booster doses. So far, in terms of achievements, we've managed to administer 17.3 million doses, out of which 7.9 million are of those who received their first dose, while 7.9 million are now fully vaccinated. Another 1 million doses have been administered to those between the ages of 15 to 17 years, and 270,000 have been administered as booster doses. From these figures, you can see that we have been able to do well in ensuring that the Kenyans countrywide are protected against this deadly virus that struck our country some 2 years ago. However, this is not good enough. If we are to contain this disease from the country, it is possible, because others have done it, we must ensure that all our people get vaccinated. We do have enough vaccines in our stores and health facilities across the country. And therefore, this is the time for those people who are not yet vaccinated to come out and visit our vaccination centers. And this is critical because failure to take the available doses could potentially mean that we have expiries in our hands. We must take all responsibility, including individual responsibility, to ensure that when an opportunity arises, that we can utilize the available resources and we ensure that we reduce on wastage. We do call on county governments to do all they can to ensure that all vaccines in their facilities are administered. Fellow Kenyans, the vaccines that we have, the vaccines that are available across the world, have short shelf lives. And therefore, this short shelf life is a challenge to many countries across the world. Indeed, expiries of these life-saving supplies have been reported in both developed and developing countries. In Africa, we've seen cases where we've had countries destroy expired vaccines. This includes our neighbors and other countries within the Horn of Africa. Here in Kenya, we at the Ministry of Health are working with county governments and partners to do everything possible to ensure that the vaccine doses we have been utilized before expiry. Measures taken include conducting campaigns, outreaches, timely redistribution of doses from counties with low consumption to those with higher consumption. In January this year, Kenya had about 2.2 million doses of the COVID-19 Astrazeneca vaccine donated through the COVAX facility. The shelf life was expiring on the 28th of February 2022. These doses have been distributed to 9 regional vaccine stores for utilization by the counties. And so what we did as a ministry, we conducted 2 campaigns in January and February this year with the aim of ensuring that we utilize those doses before they expired. We received information to the effect that despite our hugely successful campaign that saw on certain days us being able to vaccinate close to 200,000 doses in a day, and more than 3 million doses that were administered over a 2-week period, that the country may not be able to utilize all the AstraZeneca doses that are available before expiry. We have reviewed data returns from all the 47 counties across the country. Preliminary reports indicate that close to 840,000 AstraZeneca vaccine doses received through the COVAX facility have expired. These reports indicate that every county has some expiries, with the highest being in Nakuru at 35,000, followed by Busia at 27,980, Kajiado at 25,770, Kakamega at 12,870, Kwale at 11,730. And so, fellow Kenyans, AstraZeneca indeed has had particular unique challenges in its administration. Some of these challenges in taking up those doses has been one, complacency by ourselves, as Kenyans, in being able to take up the jab following the reduction of the positivity rate and the number of COVID-19 admissions. I'm sure just a few weeks to a month ago, you noticed our trends had gone down, the positivity had come down, and some mandates were lifted. And this then led to complacency amongst us, causing the loss of those 840,000 doses of Astrazeneca. The daily vaccination rate has reduced from a high of 252,000 recorded early last month to an average of about 30 to 40,000. So just a few weeks ago, we were able to do close to 200,000 doses a day. Now we're at 30 to 40,000, a steep reduction. The uptake of the second dose to ensure full vaccination status is also declining. While out of nearly 900,000 Kenyans eligible for a booster dose, only 270,000 have turned up. And so clearly, a clear picture of complacency amongst us citizens of this great country in coming in for a second dose, in coming in for our booster doses. We are not doing it. The preference of certain types of vaccines has been also witnessed. As we concluded the campaigns that we had, we noticed that there was a preference. Some people demanded certain types of vaccines, and when we offered them AstraZeneca, they declined. Yet we've always emphasized that all vaccines approved by the World Health Organization are effective in the prevention of severe diseases and also in preventing the need for hospitalization. Number 3, we continue to witness vaccine hesitancy attributed to rumors and misinformation, especially rumors and misinformation around fertility concerns. This is featuring in some counties within the country. And in this regard, we do want to work with our religious leaders who can really help us address this issue of misinformation. These rumors have been subjected to scientific query, and as it stands right now, there is no scientific evidence. And therefore, those are baseless rumors. The idea that receiving a vaccine will cause you to be infertile is incorrect. Fellow Kenyans, we at the Ministry of Health are concerned about these expiries, especially after working so hard to get the doses into the country, and this was crucial in terms of the fight against the pandemic. Any expired dose sadly represents a missed opportunity at saving a life. Every expired dose is a missed opportunity at saving a life. So going forward, we are instituting the following measures to minimize future potential expiries. 1, henceforth, Kenya shall only accept donation of vaccines whose shelf life is at least 4 months at the time of delivery. 2, we shall work with counties and partners to scale up communication towards demand generation and continuous community mobilization. Number 3, counties must ensure continued prioritization of COVID-19 vaccination and implement measures that ensure utilization of all doses within their jurisdiction. And 4, we do call upon you, all eligible Kenyans, to show up at the nearest vaccination post to get vaccinated and to ensure that you're protected against the COVID-19 disease. It is also worth noting that we are soon getting into the flu season, which globally has been associated with a spike in COVID-19 infections. The time to get protected from possible risk of infection is now. And finally, I continue to urge each and every one of us to continue adhering to the containment measures that we have advised, to maintain high levels of hygiene, and to show up and avoid those missed opportunities. Come forth and get vaccinated. The doses are available. We thank you, and now we welcome questions and answers.
Is it only AstraZeneca that has expired so far? Yes, it is only AstraZeneca. We have a standard operating procedure where by the 10th of every month, we require counties to give us their stock status from the facilities. The facilities report to the counties, and the counties report to the National Ministry of Health. And in that one, they tell us how many vaccine doses they used, how many were wasted, and how many have expired. So we had, as clearly stated, about 2 million 2.2 million Astrazeneca vaccine at the beginning of January, and by 28th of February, 843,000 doses had not been used, and these ones are therefore expired. So we received this information, consolidated it last week. Out of this, about 570,000 were in the regional stores, and 270,000 were in the facilities ready for use. So yes, so far it is only AstraZeneca. However, as the CAS has stated, we have a potential of expiry of J&J by 15th of April, about 1 million doses if they are not used. And let me explain, J&J, if stored at minus 20 degrees, the shelf life is 2 years. However, you recall that in December, we got 5 million doses from the government of Germany. Minus 20 degrees cold chain is also shared by Moderna, and that time we also had a lot of Moderna. So we thawed means you remove from the deep freezer, ready for use. J&J is popular. The demand has always been high, especially among young people. So we expected that we can use all these doses. But from what we are seeing now, if people don't show up in the next 3 weeks, up to 15th of April, there is that danger. We are going to do our best in terms of communication. We are especially going to try and reach in colleges and institutions of higher learning, and hopefully then we'll utilize all of them before their expiry. And we'll be seeking your support to ensure there are no expiry by encouraging Kenyans. The game is not over until it is over. Then finally, just on the disposal, the process now is we already alerted COVAX on these expiries. We are going to collect all those expired, and we are going to use centers that have incineration so that they will be banned, so that they are not a danger to the environment. Thank you.